Hey, what is going on? This is Adam Cooper, Senior Healthcare Insurance, and in this video we're going to talk a lot about the differences between Medicare Advantage and Medicare Supplements. We're going to duke this out real quick. Hopefully by the end of this video you will have a better understanding of what the pros and cons are for each one, so that way you can make a really good decision for yourself on which route to go. So don't go anywhere, we're going to get started right away. All right, so for the most part, and when it comes to Medicare, there are two main options that most people have. Unless you're going to retire from your employer and keep your group insurance or have TRICARE. VA, we're going to kind of set that off to the side because there's mixed details about the VA and getting VA benefits. So we're not even going to touch that right now. But for everybody else, there is two main options that most people go with, and that's either going with a Medicare Advantage plan. And Medicare Advantage plans, this is what you're seeing on TV all the time, all the different commercials and things like this, and you know, comes with the dental and the vision and the hearing and all these other things, and all these plans that cost nothing. So we're going to talk about that. We're going to talk about the pros and cons of those types of plans. Now, one of the things that doesn't get nearly as much TV commercial time are Medicare supplement plans, and they are completely different and they work completely different, but they've got some major things that you want to make sure that you're aware of before you make that final decision on which one to go with. So let's go into this for just a second. A little brief history about Medicare Advantage, not history, a little bit more information about Medicare Advantage. So what Medicare Advantage is, it's known as Medicare Part C. They typically include a prescription drug plan, and they combine it together. So it's Part C and Part D. And what Part C does is actually combines all of your Medicare Part A and Part B benefits, but runs it through a private insurance company. And when that happens, when you go to the doctor, hospital, specialist, whomever you go to, what happens is you show them not your red, white, and blue original Medicare card, you show them the Medicare Advantage card from that private insurance company. When your provider, when your doctor or hospital files a claim, they don't file it with the red, white, and blue Medicare card. They file it with the Medicare Advantage company that you're with. They pay your claim minus either a co-payment, a flat dollar amount, or a co-insurance, a percentage of whatever that bill is. Now, the two main types of plans that you will find out there with Medicare Advantage is called either an HMO or a PPO, a Preferred Provider Organization, or a Health Maintenance Organization. What that basically means is a PPO, you have a set amount of doctors that are contracted with that plan. Now, you're allowed to go outside that network, but understand you're going to pay more. But here's what's more important. If you have a PPO plan and you decide to go outside your network, understand something. Just because the plan allows you to go outside that network doesn't mean that the provider has to take that plan. They're not required to, so keep that in mind. An HMO means you don't have any out-of-network benefits. And when I explain that to people, especially when you're turning 65, brand new to Medicare, and talking about those things, I hear this all the time. Well, then can't I just show my red, white, and blue Medicare card and let regular Medicare pay for that? No. When you're enrolled in a Medicare Advantage plan, what happens is Medicare is actually sending a predetermined dollar amount to that plan. Now, it's going to be different amounts in different areas, different states, different counties. It's going to be different everywhere. So there's really no set finite amount of money that Medicare is actually sending that insurance company to administer your Medicare benefits. But nonetheless, whenever you are on a Medicare Advantage plan, you cannot use your regular red, white, and blue Medicare card. So you don't even show it. Now, don't get rid of it, okay? Don't throw it away or anything, but you don't show it to anybody, okay? So here's the pros of Medicare Advantage. One is extremely low or no monthly plan premiums. You see this advertised all the time. and you have co-payments that are involved when it comes to the doctor, the hospital specialist. Basically, anything and everything that you do for your health coverage, you are going to have a co-payment for. Now, there may be some times that there may be certain things that don't. For instance, you'll see advertised a lot that your regular doctor visit is no co-payment. Well, it depends on the plan, but that is true. There are some plans that do not have a co-payment on your regular physician doctor office visit. Now, depending on what part of the country you're in, depending on what county you're in, there may be some other plans that have even more rich benefits than other areas of the country. So I can't go into specifics about that, but just understand there's a co-payment involved for the most part of everything that you do. But the very, very low monthly or no monthly premium. There's extra benefits that Medicare Advantage provides beyond traditional Medicare, the red, white, and blue Medicare card. For instance, it comes with, some of them come with dental coverage, vision coverage. Even though Medicare does cover some vision, it's very limited, and it's not for vision that the way you would normally think of it, meaning you need glasses. Okay, it doesn't pay for glasses unless it's after a cataract surgery. That's regular Medicare. But Medicare Advantage plans do come with some, not all of them, some of them come with those vision benefits that allow you to go get a pair of glasses at no cost or very low cost to you. They come, some of them come with hearing benefits. Some of them come with over-the-counter benefits. So vitamins and Band-Aids, things like that, you can actually go pick up at the store or have mailed to you some of these over-the-counter items. Most of the time, not all the time, but most of the time, the Medicare Advantage plans, again, include prescription drug coverage. Now, you will find some plans that do not have prescription drug coverage attached to it, but the reason that is because those particular plans were designed with VA members in mind. For those of you who have VA that can get your medication from the VA, you can get a Medicare Advantage plan that does not include prescription drug coverage and not have to worry about any type of penalty. Now, and I want to talk about that for just a second, just because you don't have VA doesn't mean you can't get one of those plans, but it's probably not in your best interest. Again, subject for another video altogether. No health questions, okay? If you decide that you want a Medicare Advantage plan now or 5 years from now, you don't have to answer a single health question. None at all. Now, there are some plans that are designed for people who have certain chronic medical conditions, and you have to answer questions, but that's just to qualify you for that plan, like diabetes. There are some plans out there that are specifically designed for people who are diabetic in mind. And if you don't have diabetes, you can't get that particular plan. Okay, but it's not health questions to eliminate you, it's to qualify you. So we talked about the prescription drug coverage is already included most of the time, no health questions, extra benefits, low or no monthly premium. So let's talk about some of the downside, okay? Earlier I talked about how those plans come with networks, meaning a PPO or an HMO. And what that means is you don't have full freedom of choice. With original Medicare, the regular red, white, and blue Medicare card, you're allowed to use any provider anywhere in the country as long as they accept Medicare and accept you as a patient. So with a Medicare Advantage plan, you don't have that option. So if you travel a lot, that may not be the right plan for you. May not be a Medicare Advantage plan may not be the right thing for you. But you also have a potential high out-of-pocket cost. So very low or no monthly premium, but a potential high out-of-pocket cost. So all these plans come with what's called a maximum out-of-pocket spending limit. It's a stop loss on your spending, and it does not include what you spend on prescription drugs, but it's for all your medical purposes, all your medical procedures and things like this. So the most common one you'll see is around $6,700. Some of them can be a little bit lower than that. Some of them are a little higher than that. It just depends on, again, on the plan, depends on the area of the country that we're talking about. But nonetheless, it's a potential high out-of-pocket cost. $6,700. It can be a lot of money for a lot of people, especially on a fixed income. Okay, they are on an annual contract with Medicare. So with Medicare Advantage, every single year, all these Medicare Advantage companies are having to renew their contract with Medicare for those particular plans. So they've got to submit those plans to Medicare. Medicare's got to approve them. They've got to make adjustments. Then they got to send them back. So what may work really well for you one year, that particular plan may not be the right plan for you the following year. So every year they can change things up. They may have higher co-payments, lower co-payments, what have you. So you need to keep that in mind. They can change. Also, the plans that include your prescription drug coverage, the formulary, the list of prescription drugs can change as well. So they may drop a medication off or several medications off of their formulary, meaning they're no longer covered. Or they may change them from a certain tier level to another tier level at a higher cost. That's a possibility as well. When it comes to cancer, a lot of people think about, when they think of cancer, okay, who are the best cancer treatment centers? A lot of people think of MD Anderson and the Mayo Clinic. Well, for the most part, most Medicare Advantage plans, you cannot use either one of those facilities. They don't contract with every Medicare Advantage plan out there in the country. There may be some, they may contract with some that are more local to their facility. Maybe. I haven't looked that up, but I'm in Arkansas, and all the Arkansas plans that I'm aware of, none of them have a contract with either MD Anderson or the Mayo Clinic, which means they would be out of network. So if they have a PPO plan and then they accept it, you're going to pay a higher cost. And that's if they accept it. If you have an HMO plan, you can't go there. Let's see. There are a lot of plans to choose from when it comes to Medicare Advantage. First of all, there's a lot of companies that offer Medicare Advantage plans. And among those companies, they have a bunch of Medicare plans underneath them. So it can be kind of cumbersome to research and try to figure out which plan is right for you. Now, that's where I come in as an independent broker. I contract with the companies, and I don't work for any one specific company, but I find the plan that fits you. So we look at the doctors, we look at your prescriptions, we make sure that everything fits before we even recommend a plan. And if there's some piece of the puzzle that doesn't fit you, then we don't recommend that plan. Okay, so those are the cons of Medicare Advantage. So let's talk about the pros and cons of a supplement plan. Pros: there is no network. It follows Medicare around just like a little puppy dog. It follows Medicare around wherever it goes. Anywhere original Medicare can go, but your red, white, blue card, a Medicare supplement plan can go also. Now, before we go any further, a Medicare supplement, Medigap, same thing, different word. Okay, it's interchangeable. You have lower out-of-pocket costs than Medicare Advantage. So if you have a hospital stay or an outpatient MRI or outpatient surgery, your out-of-pocket costs are lower than with Medicare Advantage. Once you're in a supplement plan, you cannot be kicked out of it. So they're guaranteed renewable regardless of how poor your health gets. No matter how much you use it, they cannot kick you off other than for non-payment. If you don't pay your premium, yes, they'll cancel it. But for any other reason, they cannot. Now, the plans don't change the way they work. So if you are on a Plan G, no matter what, that Plan G will work the exact same way from this point forward. The plan itself will not change the way it works. Unlike Medicare Advantage, which has an annual contract with Medicare and can change from year to year. A Medicare supplement plan does not change. Now, that's not to say that the Medicare Part B deductible, and I'm going to go into a little more detail. We're not talking about specifics of a Medicare Advantage plan, but the Medicare Part B deductible, that changes every year, but that's Medicare changing it, not the plan. Okay, so that's something that can change, but it's not the plan that's changing it. Also, if you decide to go with a Medicare supplement plan and that premium happens to increase in price, or there's another company that comes out and offers a lower premium than what you're paying, you can change that at any time of the year, unlike with Medicare Advantage, where in general, now there's special exceptions, but in general with Medicare Advantage, you're on it from 1 year at a time, and you can change the Medicare Advantage between October 15th and December 7th with a January 1st effective date. But if your premium on your supplement plan happens to change, or there's another company that comes out at a lower rate, well, you can change that in the middle of July if you want to. Now, the thing there is you have to be able to qualify medically, for the most part, to be able to make that change. And again, different states, different rules. There are some exceptions to that. But in general, you can change your Medicare supplement plan any time of the year as long as you qualify medically. And the reason I'm saying that is because when you're first turning 65, you can get a Medicare supplement plan, no questions asked. After a certain period of time, after your initial enrollment, if you decide to change later down the road, say you're 66, 67, 68 years old or older, you can change, and they have medical questions that you have to answer, which means they can turn you down. So that's kind of a con. That's a downside to it. So we're going to talk about that next, is the downside to a Medicare supplement plan. They do have higher monthly rates than Medicare Advantage. They don't include the dental, the vision, the hearing, all the bells and whistles that Medicare Advantage comes with. It doesn't. The Medicare supplement plan does not include those with it. It's a straight up secondary health insurance plan. No frills, no thrills. And did I say it twice? Anyway, there's nothing super spectacular about all the extra little bells and whistles and benefits that come with it. Anyway, but it pays really, really well. Rate increases. So each year, not every year, but they typically have rate increases. So they can go up over time. But that is where being able to make that change to another plan or another company at a lower rate comes in. And again, you can do that any time of the year. Another pro is that I forgot to mention is the plans are standardized. Meaning a plan G is a plan G is a plan G, regardless of where you get it from. A plan N is a plan N is a plan N. And those are the two most common, most popular plans. There are more plans than that. But plan G, plan N, those are the two most popular as of this video. But they're all standardized, except for a few states. Some states do have like an a la carte type way that they've set things up. And you pick and choose and build your plan. But you can build them to look like other plans from other states. Let's see here. I want to make sure I've covered everything here. Oh, there's no prescription drug coverage included. So you have to go out and get a separate prescription drug plan to have drug coverage. Unlike, again, Medicare Advantage that comes with it. Let's see here. I think, and you can go to MD Anderson or the Mayo Clinic because you can go anywhere Medicare can go with a supplement. So having said that, again, one of the pros is for travel. So if you like to travel a lot, do RVing or just vacationing a lot throughout the country, a Medicare supplement is probably a smarter route to go for you because you don't have to worry about that network with a Medicare supplement plan. So having said that, I think we've covered everything, all the pros, cons, or otherwise with Medicare Advantage and Medicare supplement plans, also known as Medigap plans. Now, my name's Adam Cooper again. If you need help figuring out this whole Medicare thing and you are looking for someone to take the time to explain your specific options to you, that's what I'm here for. I'm an independent broker. My number here is 870-215-3136. You can also text me at that same number if you don't feel like making a phone call at the moment. You can call or text that number. And I appreciate your time. Make it a great day. I'll see you in another video. And again, if you've got questions, be sure to give me a call. Also, if you have some other questions, leave a comment below in the comment section. Ask your question. I check these things all the time. I'll be more than happy to answer your questions for you to the best of my ability. Again, I appreciate your time. Have a great one. I'll talk to you another time. Bye-bye.